I was diagnosed with late-stage 3 breast cancer in February of 2015.
Diane Simard remembers it well.
It was quite a shock.
1, 2, 3.
This Colorado businesswoman did what many who receive this diagnosis do. She underwent surgery, extensive radiation, and chemotherapy.
The thing with chemo is that the drugs are bad enough that they're putting in your system, but it's the repetitive nature that really starts to wear on you. And so I was getting very down and depressed.
She asked her oncologist for professional help to deal with those feelings.
She said, I really wish I could. In fact, if you know of someone, I would like to know who they are.
What they didn't tell
That experience drove Simard to help found the University of Denver Center for Oncology Psychology Excellence, or COPE.
friends had.
Here, graduate students in psychology are taught how to provide psychosocial services to cancer patients.
My mom was diagnosed with breast cancer about 8 years ago.
As one of her mother's caregivers, student Hannah Katz says she found the physical side of cancer gets much more attention than the emotional side.
There's not really any psychological support out there, specifically for survivors.
It's a real problem. Cancer patients often have anxiety and issues with relationship changes, body image, and loss of hair. Depression is a common theme, too.
Having reduced depression can increase adherence to treatment, and that helps overall with reduced mortality, increased quality of life, all of those kinds of things. So
COPE Director Nicole Taylor says some hospitals and cancer centers are seeing the benefits of psychological support for cancer patients.
I think it's starting to change a little bit.
This first-of-its-kind program in the U.S., which began in September, includes role-playing exercises in which students play both healthcare professionals and patients. One cancer survivor says she could have used this kind of help several years ago.
There were definitely things that were not there.
Simard predicts those services will become more and more common. She says it only makes sense.
You're more likely to have a patient that has a better quality of life if you're looking at both the psychological and the physical aspects of who they are as a human being.
Hendrik, Sybrandy, CCTV, Denver.